Good evening, everyone. I am Congressman Jared Huffman, and we are now live for our town hall this evening. So glad that you have joined us. And I want to thank so many people in my district that have been engaged for days leading up to this. We've been getting hundreds of excellent questions from many of you, and we will put as many of those questions into the conversation tonight as possible. So really appreciate that. Thanks to the media outlets who are helping us broadcast this program tonight up and down my district. And of course, we're talking tonight about the COVID pandemic. This is a crisis that we're by no means nearing the end of. It's been a difficult winter and we've got a lot more work to do. But one issue that I think is on everyone's mind increasingly, certainly if you look at the calls and emails and letters I'm getting, is vaccines. And it is the most hopeful part of this crisis. The fact that we, in less than a year, have multiple safe, effective vaccines that can save lives and accelerate our path out of this. But it's also a frustrating issue right now because the rollout's been slower than any of us want. And it can be confusing because there's a lot of changing and seemingly contradictory information out there. So tonight we're going to do a deep dive on vaccines. I have some outstanding guests and panelists. We will do our best to answer as many of your questions as we can. My staff has sorted those questions into themes, and so we will combine some of those in a way that helps us cover more ground tonight, but we're not screening or filtering. And I'm sure those of you who are joining on Facebook Live will continue sending your questions in as we go forward. I will ask Jenny on my team to go ahead and jump in with some of those questions periodically as well. Tonight's town hall is focused on Mendocino, Humboldt, Trinity, and Del Norte counties. Last week, I did another one where we focused on the North Bay, on Marin and Sonoma with public health experts from that region. If you missed that one and you would like to watch, you can certainly do it. It is saved on my Facebook and YouTube pages. But tonight, we're going to focus on the more northern communities in my district. And I want to introduce my special guests tonight, then we'll dive into your questions. So first of all, joining me, my state legislative colleague, a great representative for the North Coast, Assemblymember Jim Wood, also chair of the Assembly Health Committee, so a really important leader on all of these issues. From Humboldt County, Dr. Ian Huffman is the County Public Health Officer. We're delighted to have him. A little further south, we have the County Public Health Officer of Mendocino County, Dr. Andy Corin. And with us tonight from the Veterans Administration, I'm really pleased to have Dr. Heather Nye. She is the Associate Chief of Medicine at the San Francisco VA Med Center. So a couple of opening thoughts from me, and then we'll get rolling. First of all, we're less than 2 weeks into the new Biden administration. And even though it's only been a few days, I want you to know that I already see major changes in our national response to this pandemic. We've obviously got new people in place. They are really the best of the best at what they do. Our top experts are not being muzzled. They are the ones we're hearing from at press events and briefings and other things. And there's a new focus on science, on consistent messaging, on transparency, on accountability. And on one of the things that I've been asking for, the better part of a year for our federal government to utilize, the Defense Production Act. It is this really powerful tool that exists only for the federal government that lets them literally commandeer manufacturing capacity in emergencies so that we don't have chronic shortages of things like PPE. And we can even do that for aspects of the vaccination program. So I'm delighted that this is finally being more seriously utilized. Last week, I had a chance to join a Zoom call with the new COVID czar. His name is Jeff Zients, and with Dr. Fauci and other members of their team, and hear a little bit about their plans. Now, this 100-day plan that you've been hearing about is not only about vaccines. There are also mask orders for federal property, for various modes of transportation, airports, airplanes, trains, buses. There's new procurement and distribution strategies for testing and PPE, again, including use of the Defense Production Act. But the centerpiece is their goal of vaccinating at least 100 million people in the first 100 days, hopefully a lot more than 100 million people. And in order to do that, there is a major focus, and we've seen major changes on several specific things. First of all, getting more of the vaccine. That's the big one right now. And so you are seeing contract options getting exercised. You're seeing new contracts, better accounting of what's already out there. Some of this was purchased at great cost, and yet it's very hard to get our arms around where the heck it is right now. So that's part of the challenge. Hopefully bringing new producers online. You've probably heard about the Johnson & Johnson vaccine that may be nearing emergency use authorization. Looks like a really good new option. And then of course we've got at least one other vaccine out there as well that's a few weeks down the road because of some additional data. But new vaccines should start to come into the mix. And then more places. So obviously you're familiar in the North Coast with the places that are currently authorized to distribute the vaccine, but we haven't had federal vaccination centers. That's going to change. We're going to start to see FEMA and the National Guard actually stand up federal vaccination centers, not to compete with these other places, but to add to them. And that's going to be really helpful in rural areas and underserved areas. There's lots of talk about mobile vaccination centers. You're going to see all of this ramp up in the weeks ahead. And then more people to administer the vaccines. So the big contribution there is the Health and Human Services Department has already relaxed rules so that folks that are permitted to administer vaccines can cross state lines and do that any place without getting hung up in permitting or other bureaucracy. One final piece of this, as we hit these numbers, hopefully again, way over 100 million in the first 100 days, we also want to address the equity issues. We know that the COVID pandemic has exposed terrible disparities in our health system, that it's been a disproportionate impact on communities of color. And as we hit these numbers, we don't want to just do it in ways where the affluent communities that already have all the capacity to vaccinate get it done and others go without. So you're going to see community health centers, you're going to see Indian health clinics and others utilized in a very purposeful way to make sure we're addressing the equity issue as we go forward. So even with all of these efforts, and I'm really encouraged by what we've seen in the first 2 weeks, it is still going to take a while to fix the supply shortage that is causing so much frustration and confusion right now. My hope is that the new plan to provide at least 3 weeks lead time to states and local governments and others is already starting to make a difference in terms of planning and answering questions from frustrated constituents. But we'll have a chance to ask our public health officers about whether they're seeing improvement on that in just a moment. Many details of these plans from the new administration are still taking shape. The information is very fluid, but I want you to know that my staff and I are going to keep tracking all of this as it rolls out. We'll do our best to share details with you as we learn them. One final point. My congressional colleagues and I have put billions of dollars of new resources on the table as a down payment for our vaccine distribution efforts. We did that in December, but I'm also working with colleagues in Congress to support President Biden's American Rescue Plan. You may have heard about this. It's a $1.9 trillion proposal, an emergency legislative package that would enable us to do all of the things that I think we need. I'll be supporting that. We passed a budget reconciliation bill just tonight to move that forward. And in the days ahead, you're going to see hearings and much more detail on the particulars of what goes into that package. So with that, let me turn to my colleague, State Assemblyman Jim Wood. Jim, I'm going to be firing questions at you here in just a moment, but did you have anything you wanted to just lead us off with by way of opening thoughts?
Well, first of all, thank you very much for the opportunity to be here with you tonight and work with you on this town hall tonight, Congressman. I think one of the things that is really heartening about your comments was the fact that we are going to be really doing everything we can to ramp up the supply I think what we're seeing in California here is that the infrastructure has taken great shape, and I think that there's counties that are doing a fabulous job of being able to administer the vaccine, but the weak link is the amount of vaccine. And so the sooner we get that and have it in a reliable way, the sooner we're going to all be much better off. So I'm looking forward to questions tonight, and I thank you for the opportunity.
Excellent. Well, thank you. I will kick us off with the first question. And as we go forward, I may direct some of these questions to particular panelists and guests. But let's start with our two county public health officers. And, these are the big questions that I know I'm getting a lot of. People want to know what is the status of the vaccine distribution program at the local level. So when can they get their vaccines? Where are they going to get it? What is being done to move it along faster? And what are the numbers so far? What have you been able to do, and what do you hope to do in the days ahead? That's a lot, but I will go ahead and turn to our county public health officers to start us off. So Dr. Nye, do you want to go first? Oh, I'm sorry, I misspoke. Yeah.
I think I'll go probably near the end.
That's the VA piece. So let's start with Dr. Corin in Mendocino, and then we'll go to Dr. Huffman. I'm going to come back to you, Dr. Nye, on the VA in just a minute. And you're muted, Dr. Corin. There you go.
Thank you, Representative Huffman, and thanks for inviting me here today. Yeah, Mendocino is suffering like the rest of the community in the world from this terrible pandemic. Just to remind everybody, today we passed 449,000 people killed by this virus. So if anybody thinks this is just a flu virus, this is more people than died in World War II, and it's in 1 year. So this is huge, and we're trying to respond to that. In our county, we've been blessed with developing partnerships with our 3 hospitals in the county, 6 active rural clinics, and our city of Ukiah, all of whom are involved in the vaccination distribution effort. We have already distributed, let me just check my number here, 11,163 people have been vaccinated. Those are individual people. We've got more of those altogether vaccinations. And if we look at just the members of our community who are over 16 years old and therefore could get a vaccine, we have distributed vaccines to 15.8% of those eligible people. Our supply is, as you said, the biggest challenge. There's no question about it. Not having the supply means ourselves and our partners have to schedule many clinics, have to schedule many volunteers and other professionals to help with the clinics, and then they wind up not having enough vaccines. And we don't know until several days how many vaccines we'll really have to have, and or how many we will have. And so it's very disruptive. The state and country has also gone through many different permutations of scheduling programs and ordering programs. We're now actively learning how to use My Turn. We had invented our own scheduling program for a while, and using spreadsheets and hand-drawn lists that we got from the schools and from the hospitals and so on and so forth. But now we're being able to hopefully link into some very effective state platforms that'll work for us and for the community. So in Mendocino County, we have focused on those tiers for equity and ethical distribution of these scarce supplies. And we've made pretty much through the phase 1, tier 1, 2, and 3, and are firmly into 1B. There are still some stragglers in the phase 1A, but we've pretty much gone through them. And one of the things that we did early on was develop an ethics committee, which could help us with changes in that structure based on what we thought locally made more sense. And based on some outbreaks we had, we moved up the law enforcement, the sheriff's department, and also water and waste disposal, which we did not want to risk another kind of epidemic. And we have emphasized, now that we've gone into 1B, the teachers. And so we've vaccinated in the range of 70% of all of our teachers. The schools are excited to be working with the teachers and the staff in the schools, and are anxious to be submitting their plans. We've already got one school system plan that's been submitted and passed on, and another one's on the way. So everybody's excited about that. At this point, we're still deep in the purple tier. So we can't have new applications of schools to open, but those who began to open can continue and increase their activity. Because we have gotten our case rate down to under 25, which was the criteria that the California Department of Public Health set up. So that's on its way, opening the schools. We are actively working on those over 75 years old. And we found early on that our mass vaccine clinics, which were set up and doing very well, created a little bit of a hazard, to say the least, for some of the 75-year-olds to go across the terrain on the fairgrounds. And so what we've decided to do is emphasize those over 75 should be getting their vaccines through their clinics and through the hospital clinics. And the hospitals are also having some of their own stand-up vaccination events. And those are on more friendly terms. Plus, the clinics know their patients from their electronic medical records who are over 75, or who, as we go on to the over 65, who have comorbidities and so on and so forth. So that group, we're trying to separate out and focus them through their providers. The county vaccine clinics and the rural health clinic vaccine events that are more mass events are going to focus on people who are at risk because of their employment. So the ag workers is one group that we've already begun to vaccinate. And that's a long list.
Great.
But we're working with various different partners to get their lists into us and work our way through it. And
All right, appreciate that very much. Let's go to Dr. Huffman in Humboldt.
Thank you, Congressman Huffman and Assemblymember Wood. And yeah, so an update on vaccines here in Humboldt County. Many of the same themes that Dr. Corin mentioned. Supply is really the main issue at hand right now. We started early on in the delivery of the vaccine in the beginning or middle of December, rolling this out through the hospitals and into the healthcare workers. We expanded out from there into the clinics, and each round we kept growing the sites that we could give the vaccine in. We have now, like Dr. Corin mentioned, in Humboldt, we've mostly moved through the phase 1A healthcare workers and started into phase 1B in the first tier with 75 plus. The 75 plus is a really important group because that's where the vast majority of deaths and hospitalizations and severe disease occur. So we have focused on that as the sort of, the foundation of moving through that group before we open up to other age groups here. We also, though, have recognized that there's an importance to trying to get society back functioning again. And so alongside that, in the phase 1B, we've opened up to first responders, and we've started to open to some educators. This past 2 weeks, we've been vaccinating the educators K through 12 who are in person currently. We can't open up to everyone because it's just such a large group to take all at once. We didn't want to crowd out the field for a very limited number of vaccines. So we're working through that group and working with our local Office of Education to, when there's enough vaccine, open up to other educators in phase 1B, and preparing for the next round of folks in phase 1B, which would be the food and agriculture group. We've started to do some outreach. We have what's called an interest form on our website where people can go and register their interest with the county. Folks who don't have access through their doctor, because not every provider in our county is an authorized COVID vaccine provider. So we wanted to give people a place where they could go and register their interest. So that's so far collected over 15,000 interest forms. And we've been using that to fill public health clinics for the 75 and older group. We've also begun phone banking and calling some of those folks who didn't have electronic access. So that, we have a digital divide here in our rural county where there are many 75-year-olds who don't have a cell phone, they don't have internet access. Someone helped them fill out the form, or maybe they called our Joint Information Center and they filled it out, and now we have a phone number. So we're calling those folks and trying to get them booked an appointment for their vaccine. And we're also working with local independent providers to try to create a list of folks who don't have access in other ways and cross-reference that with those who do and those who've already gotten the vaccine, so we can do even more outreach. As Dr. Corrin mentioned, there's lots of changes at the state. We've been trying to do our best to keep up with them. We're joining the forces with the state of California to begin the new program called My Turn, which is going to allow people to book their appointments directly into clinics that are, providing vaccine. We're eager to hear more about the TPA and what it means for us. But really the big picture here is that we as a community over the past 6 weeks have built a large infrastructure that is able to give well more vaccine than we are getting. And we are hopeful that that vaccine will come soon. And just as Dr. Corrin mentioned, we have volunteers, we have clinics set up that are just don't have the vaccine to run them. So we're now having to scale back and wait for that vaccine to come. So I think the big question was, how do people get the vaccine? So if they're in one of those groups that I mentioned, the work groups are by invitation only. So at this point, if it opens up more broadly, we'll definitely put out more media on that. For 75 and older, if your medical provider has the vaccine, they will contact you to schedule you for an appointment based on their electronic medical record. And if you're not, then I would encourage you to go to that interest form that I mentioned so we can register you and get you into a clinic. We also have two pharmacies who are currently vaccinating, or one that's been vaccinating, one that's about to start vaccinating through the federal partnership that was mentioned with the Biden administration. So we have a Safeway who's been booking patients, mostly phase 1A healthcare workers and 75 plus age group. And then starting next week, we have a CVS here that's going to start working through the federal partnership. So we had 2 public health clinics that were running in the middle of and end of January that we had to decommission and put on hold because not enough vaccine. And so all that has now been moved into our community partners through the federally qualified health centers and the hospitals. To date, we've received 17,500 vaccines, and we've put we put 16,000 of those in arms. So we're waiting for more vaccine, and we're hopeful that when we get it, we can open up to more people. And we just appreciate all the community support and all the support from our partners at the state and federal level in helping all this happen. Thank you.
Terrific. Well, thank you very much. Dr. Nye, I'm not going to ask you for a more general statement. I'm going to go right to a specific question for you, if that's all right. And this is a question from Graham, one of my constituents, about his 98-year-old veteran mom who would be eligible for vaccination through the Eureka VA. and they have been directed to sign up at My Vet Health and 2 other COVID update links through the VA, plus the Humboldt County link. So they're really covering their bases, trying to get their mom vaccinated here. And this person lives in Berkeley and has been watching while neighbors down there that were 75 and over are getting the vaccine, while the 98-year-old mom up in Humboldt is still waiting. So I think the question is, how do elderly veterans in the Eureka area move things along faster? How can they get vaccinated? How many doses does the Eureka VA receive? And just sort of where do we stand on that and the protocol for identifying vets and getting them vaccinated?
Yeah, all great questions. It's, our story will resemble the other 2 speakers as well. Fits and starts with scheduling and dosing not coming, even though we've built the system. To address the first issue, I just want to go specifically to your constituent's 98-year-old mother who is in Humboldt County. We are going to be vaccinating veterans up in Humboldt County we started last week, very slowly. There were, I believe, 30 doses that went up there. That doesn't sound like much, but we're given a total of 500 doses a week here. So that's how few doses that we have to split up among our 6 CBOX sites and our San Francisco site, and we split it evenly. So we let the doses go where the veterans are, but proportionately, everybody's getting their appropriate amount. Unfortunately, it's just far, far fewer doses than we have veterans to vaccinate. So the good news is of all the VA facilities, I believe San Francisco is the only one that actually has operations, not traveling vaccine operations to the CBOX sites, but the CBOX sites themselves are ready to gear up when we have a bolus of vaccines to something upwards towards 1,000 doses a week. But we are waiting for vaccine as well. That won't require a separate van going up in a traveling committee of people who are giving vaccine, but the CBOX themselves, Eureka, Ukiah, Santa Rosa, Clear Lake, they are all ready to deliver as much vaccine as we can get as soon as it comes. And I think that we went with CDC tiers like everybody else did. We first vaccinated our healthcare workers to maintain a safe environment and continue operations for veterans. And then we proceeded to patients and quickly vaccinated about 2,000 patients. And we've only received a total of 5,500 first doses. We are getting 500 doses a week. We don't choose that dose. We don't choose that allotment, but we are working hard and advocating as hard as we can to get additional allotments. But in the meantime, we have tried to message people through email, through websites, and we've been doing direct outreach to veterans who have neither an email nor a texting device with direct outreach phone calls to try and get them scheduled if they're over 75. So we're well aware that there is the digital divide and working hard to overcome that as well. Our supply chain is different than the 2 counties because we're getting them doses federally delivered from the VA. And as crazy as it sounds, it may be even murkier than how you get them from the state because it's hit and miss. And as soon as we hit steady state, we may be told to stop. And sometimes we are blessed with a windfall of doses. And the good news there is that we're ready to ramp up. I mean, we could be vaccinating 2,000 veterans a week between all of our sites. We just need doses, but the programs are built and ready.
Okay, terrific, Dr. Knight. Thank you very much. So let's go to Assemblymember Wood. And by the way, for all of our guests, if you want to jump in and add things or even ask each other questions, whatever, just raise a hand there and I'll try to keep us moving along together. But Assemblymember Wood, Margaret asks about this whole, well, first she points out that Blue Shield and Kaiser are not in Humboldt, and so anything that they have to offer are not of much benefit, but she was confused and surprised that Blue Shield Insurance is suddenly in the mix on a contract basis through the state. She wants to understand why that is happening and whether it is even a good idea and whether that's something that will actually benefit the county public health department efforts, or whether it'll just add another layer and possibly confusion. What do you think?
Well, I think it actually will make a difference. How this is going to evolve is still taking place. But the role of Blue Shield in this is going to be about getting those vaccines out to the providers. That's going to be their primary role. And so we've got all these community providers, whether it's FQHCs and hospitals and others. Their role is going to be able to get that out and hopefully in a steady stream, so that some of this lack of predictability that you're seeing at with the counties and when doses are going to come in will be eliminated. So and I think there were a lot of people who said, "Oh my goodness, an insurance company? Why an insurance company?" Blue Shield is a not-for-profit insurance company, so they're not going to make money on this. They're going to get reimbursed for some of the costs to help the state, but they're not going to make money on this. And I think that's a really important point. The other point is that they have, and while they may not have a real presence in Humboldt County, they have, of any company in the state, the broadest penetration of the market and the best understanding of the providers. And so while we're still waiting to see a lot of how some of these details are going to work out, I haven't seen the contract yet, but just want to assure that they're not going to be making money on this. This is purely about helping us to streamline the process, and hopefully it won't be more complicated. We've been in the background pushing on that. This needs to be as easy as possible for everyone.
All right, thank you, Assembly Member. The next question is from JJ, and it's sort of directed to Dr. Corin, but frankly, anyone can answer it. And it is about the virus mutations, or these variants that we're hearing a lot about in the news. JJ points out that we seem to be in a race against these variants, and I think that's right from my conversations with Dr. Fauci and others. The faster we achieve mass vaccination, the less spread of any disease and variant, the more protection we lock in, even if it might be at a slightly lower efficacy with some of these variants. But the more we reduce the spread, the more we also cut down on mutations, because the more virus is spreading, the more it's going to keep mutating, and we will lose the race with variants. So I think that the thrust of JJ's question is, if we're in a race with all these variants and mutations, why aren't we vaccinating those below 75 years of age? I think I have a sense for the answer, but let me ask the pros to explain why we need to, if you believe we need to stick with that 75 and up category for now, why that is the case.
The question is a good question. I think first, just to start off, to let the audience know that there are at this point known 4 major mutations, variants in the world. Not all of them are here in the United States. The UK variant, or B117, has been around for the longest and swept through Great Britain and undermined their healthcare system and did what we had happen in Los Angeles. And so that's the thing that concerns us the most, because that particular variant is much more easily transmissible than the native COVID-19 that we know. There are 3 others. One is South African, which I believe they've said is more aggressive as a virus and may have some resistance to vaccines. These haven't been around long enough to be sure of a lot of the characteristics. There's another one from Brazil, the P1 variant, and I think that is less known. At least I don't know that much about it, but I think the concern is that it would be more transmissible, and I don't think they know whether it's more virulent yet, or whether it is resistant to the vaccines we have. And then we've just found one that's native to California. And again, it's been around too little for us to know enough about. The state of California is embarking on probably the largest, as I understand it, genome analysis, and trying to take 1% of the tests that are being done through the state lab and running the genomes to be sure which ones are here and if there are any new ones coming up. The thrust of the questioner's query, though, is shouldn't we be vaccinating many more people? Yes, we should be vaccinating as many as we can, as fast as we can. The issue with the elderly is that they're the most vulnerable. And so from an ethical point of view, we want to save the most lives. And from a practical point of view, we want to keep our hospitals and our emergency rooms available so we can take care of not only them and not only people with COVID, but people who have heart attacks and get involved in accidents. And what happened during the surge after Christmas and New Year's is an example where, you know, the Southern California systems were overwhelmed, and the availability of medical facilities was really in question. So the priority being put on the elderly is still very, very important from an ethical and from a practical point of view. And you know, that's not to say that they're the only group. We definitely want to get everybody, but I think we need to preserve their health and also preserve our medical capabilities.
Dr. Corn, it also sounds from you and Dr. Huffman like we are also, right now at least, pushing vaccines out as fast as we can get them. So even though we're only focusing on 75 and up, it's not like that's causing a lot of inventory to lay around unused. Is that fair to say?
That's very fair to say. I know in our county, and I'm pretty sure in Ian's as well, by the end of the week, we have none left in the freezers. It's done.
Yeah,
And then we're waiting for the next shipment to come, which we order on Tuesday, Wednesday, Thursday.
Yeah.
Go ahead, Ian.
So we just queried our partners. We've been trying to get an inventory from them on a weekly basis, and the inventory on Monday was 1,480, and that's just enough to cover what they needed to get through in the coming days until the next shipment comes in. So you know, we're giving out 95% of what we have. And the only thing, I totally agree with everything that Dr. Corn said. The only piece I would add to that is that while we're in that race for more vaccine and more vaccinations, it is more important than ever right now for us to follow the strict guidelines that keep this virus at bay, which are the distancing, the masking, avoiding gatherings, trying to limit travel to only essential travel, because it is going to take some time to get more vaccine. As we know, we're going to, the federal government's stepping in, and we're going to get that increase in the production coming down the line, as Congressman Huffman mentioned with the Defense Act. But that's going to take time. So in the meantime, we all need to stay really close to home and do all of our measures we've been doing to stop the spread.
All right. Appreciate that. Let's go now to one of the Facebook Live questions coming in. Jenny Calloway is going to read it.
Hi, so a number of people are asking about second doses. So April McIntosh asks, is there a concern that uneven vaccination distribution might cause disruption in the cycle of the second doses at the correct timing, which could result in the virus developing a defense against the vaccine?
I guess that concern is that if distribution issues somehow cause you not to get your second dose in time, that's how I'm understanding. Yeah. Anyone want to take a stab at that?
I'm happy to take a stab at it for veterans. We have a very strict policy in terms of which doses we can use and which doses we can't. We're getting a lot of our second doses before when we still need first doses. There's such a caution around that that we know we're going to have second doses for everybody. We are guaranteed that. It's probably a very different scenario for county programs. But I did want to go back to that last question and just quickly say that there was a lot of discussion, I think, nationally and even amidst our national experts around whether one vaccination dose would be adequate, and which would mean our vaccine supply would go twice as far. We struggle with that here at the VA simply because we have so much on hand of the second dose. We are prohibited from using it from higher ups. However, I think nationally, while people pontificated about that idea of getting to herd immunity a little sooner, but with less efficacy with just a single dose. I think people thought about it, but overall, the overriding decision was we need to stick with the science, which is what we've looked at with 2 doses, and we know its efficacy, because we're kind of shooting in the dark if we just do 1 dose and how long it might last, et cetera. So that's how the VA does it. Very, very cautious about our second doses.
Thank you for that. Anyone else want to speak to it? Yeah, Dr. Corn.
Yeah, I mean, in the county level, that's exactly what we run up against. And we very much worry where the next dose is coming, whether it's the first dose or the second dose. But this past week, we were, in a hot sweat thinking about next week's, requirements for second doses. And I just want to say again, thank you, Mr. Wood, for intervening and helping us get that vaccine supply. When the vaccines were initially distributed and the federal emergency use authorization was applied and granted, there is a 2-day before and after ideal period to get the second vaccine. So I think one of the things is we're in a terrible situation with the epidemic. People are aware of that, and now that there are vaccines available, everybody wants them now and they want them on time. And what I'm saying is that we shouldn't relax what the science knows, but I think if there's a couple of days here or there for a clinic to open where there is vaccine, it's not necessary to panic about it. The CDC has also released information about first doses only and their efficacy, which is high. It's higher in some ways than some of our seasonal flu vaccines. However, when we're looking at trying to develop herd immunity, as I understand it, the calculations involve what the efficacy of the vaccine is, as well as the penetration through the population. So frankly, I'm not at that level to be able to negotiate those or figure out those equations. But I think we should stick with the 1 month or the 3 weeks as much as we possibly can. And I'm really hopeful that the new federal programs are going to release some vaccines at a much better flow rate to cover our population.
Yeah.
And I'd just like to add, Jared, if it's okay, one of the things that's going to be happening with some of the things we're changing at the state level is that those entities that are being more efficient about getting this vaccine out into arms are going to start getting more doses. We're not trying to penalize those who aren't, but when I hear the numbers, the percentages for Mendocino and Humboldt County, the percentage of population that has been vaccinated, that's far and away above a whole lot of other counties in the state. So I just want to say, my hat's off to you guys for amazing work to be at the percentages you are, and to know that every dose is going out as quickly as possible. You guys are like poster children for what we'd love to see in the rest of the state, quite frankly. So thank you.
It's partnership. Couldn't do it alone. It's
Yeah,
working with our other community members.
Yeah, no,
really,
I just, yeah.
Huge broad-based coalition of healthcare came together and made it all happen. And it started as far back as November and really just grew as each week of the vaccination effort went by. Just on the second dose issue here in Humboldt County, we also absolutely value that second dose and are planning for our second doses to the point where we might end up prioritizing second doses over first doses for a period of time where we might be coming short on first doses. But until there's further guidance on that those timeframes are set, there is some leeway. I would say CDC has put out information on the second dose that it could be up to 42 days after. So I think, as to Dr. Corrin's point, if it's not the exact day, we don't need to be anxious or nervous about it. I think it'll still be effective, even if it's a few days or even a week off. because as we're going through this, it's going to be difficult to get everything lined up exactly right. You know, and we're going to do our best to get it, you know, as close as possible to that due date.
All right. Well, terrific. Stay there, Dr. Huffman. I've got a question from Suzette about at what point can workers who have been vaccinated safely unmask in their work environment or go back to eating together, et cetera? So this really goes to educating folks about life after the vaccine. And I guess that I think there is a broad prevailing assumption that you don't have to do all of these precautions once you're vaccinated. My understanding is that that's not the case right now, but please explain.
Yeah, I wish it were that simple, that as soon as we had our 2 doses, we could just go back to normal life. You know, it's certainly being looked at when that point comes. But as of right now, we need to understand that after the vaccine, you know, you have protection for yourself. But as a society, we need to keep up all of the measures we've already been doing. I know this is being looked at, you know, both at the CDC level and the CDPH level here in California, at when that makes sense to turn that corner and open up folks who have had their vaccine, or when enough of our society has had their vaccine that we can, you know, feel more comfortable to roll back some of those measures like masking and distancing and gatherings. But my feeling is it's probably going to be a little while before we get enough people vaccinated to feel confident in rolling some of those measures back. So right now we are recommending everyone just, you know, get your vaccine, and as we see more information come out, we'll, when we feel confident, we'll start to roll back some of those measures for everyone.
And another constituent asks whether when people get the vaccine, if they shouldn't get some sort of an instruction sheet that tells them all the things that they need to continue to do. Do either your any of your clinics or partners do anything like that?
We routinely give people advice that they do have to continue all their non-pharmacologic protections. Remember, for one thing, masking is a source control. And we don't know whether the vaccines really protect everyone against carrying the germ or transmitting the germ. So that, you know, people look at doctors and they say, oh, you're smart, you know so much. Yeah, we know a lot. There's a lot we do not know. And this is the first time humanity has encountered the coronavirus. There's a lot we have to learn. These are the first batch of vaccines. There's a lot we have to learn about them. And what is efficacy? Is it efficacy against decreasing the severity of disease if you should catch it? Is it the inability to catch and carry it? We don't know that. So at this point, when we're just less than 2 months into doing vaccines, keep on masking, keep on social distancing. You know, all those things are going to be just as important as we go forward. And you know, the question before that I was answering about the variants raises another issue. If people don't continue to do this, and one of the downsides of having vaccines, this is weird, it's a little backwards thinking, but if we get overconfident, and especially with the variants, if the variants, you know, surpass the efficacy of the vaccines, we could be in for another surge. That's a very real possibility. And that would not be a surge demarcated by a you know, holiday season or by Super Bowl Sunday. It would be because we've got a whole new bug on our hands. And so people really need to be cautious. There's a lot we don't know. Keep doing what we know does work, and that's masking and social distancing and avoiding those parties and gatherings.
Dr. Nye, I presume our veterans are getting the same advice after they're vaccinated?
Yes, over and over again, we try to reiterate all the safety measures that most people didn't like to do at the beginning, but it's even harder to get people to continue with them after they've been vaccinated. But they receive a healthy packet of information and guidance on not only just continuing measures for source control should they be exposed to coronavirus, but that even if they have new symptoms, they still have to be tested. It's not that I've had the vaccine, I don't need to be tested anymore. The CDC guidance is that, you know, we just don't know. And if you have symptoms that look and seem like they could be coronavirus, even though you've been vaccinated, you need to be checked out.
Okay, I've got one more question from folks that wrote in. This is about remote rural areas behind the Emerald Curtain, and especially those involved with the cannabis industry, where there's a lot of seasonal workers, including folks that don't show up even on county data because they're seasonal workers that, with the industry beginning to pick up again, the risk of returning workers bringing COVID with them, and wondering just what are the strategies and plans for reaching out to these remote areas in the cannabis industry.
Are you directing that at us here in Humboldt?
And Mendo, yeah, I don't have Trinity and Del Norte online with us, but it would apply equally.
Yeah, we have a lot of experience with outreach to the cannabis industry throughout the pandemic. There have been several outbreaks of COVID, and our investigations unit has contacts and inroads. And so when we get to the point of food and agriculture and looking at the cannabis industry as part of that, we'll definitely be looking into using some of those inroads and trying to get as many of those folks vaccinated as possible.
Okay, so yeah, go ahead, Dr.
And
Horn.
another thing, one of the advantages of working with rural clinics is that the people who work in those clinics know those crops and the growers, and they know them well, and they've developed some trust. And so what's happening in many of our areas is just like we reach out to some of the winemakers or the agricultural workers and ask for the lists of their employees that would be eligible. We are doing the same thing with the pot growers. And and there is another issue, which is if we use the vernacular, trimmigrants are sometimes here and sometimes not, but also immigrant farm workers. And for that reason, we're kind of looking forward to the Johnson & Johnson one-shot vaccine. That would be very useful in that situation. And homeless also. It's very hard to get people twice in a row. And so we have to think of different strategies for each of those groups.
Yep. Very good. And then I also mentioned that FEMA is supposed to be bringing mobile vaccination centers into the mix, and a dedicated supply that'll be moving out through community health centers, through the Indian Health Service. We don't have details yet on the size or the timing or anything, but I hope that will be part of the answer to that as well. So I'm going to ask I'm going to kind of lump together some questions from people who are opposed to vaccines. And I'm going to pose these not because I agree with or believe in them. In fact, I think in a few cases, some of these facts are just not right, but we get them. And I know you do too. And I don't want anyone to say that we are not posing questions that come in the door. And then I'm going to go to Jenny for a Facebook Live question right after that. So for anyone who wants to jump in on this, the first question is a statement that as of February 1st, over 350 deaths, almost 10,000 injuries have been reported after getting vaccinated. So the implication is that there's this grave safety risk. I just did some quick sleuthing, and there have been millions of doses of this vaccine administered already. Almost all of them have gone to people 75 and over. So it's a cohort that is predisposed to health issues. And Dr. Fauci has said to me and others that the number of deaths and injuries in this cohort since vaccination started has not increased. So the number of deaths and injuries we're seeing is exactly what you would expect to see in this cohort of elderly, at-risk people without any vaccination. And I'm not aware of a single case where the vaccine has been attributed to a death, but please, somebody correct me if I got any of that wrong.
Well, there are potential risks to a vaccine like there are with any medicine. But I think you're right. The person who raises those numbers is just quoting misinformation, and that's not helpful for anybody. The real information is how many, hundreds of thousands of people are dying of the disease. Yeah. And when we look at those who've gotten the vaccines, it doesn't come anywhere near. Our big concern with any vaccine is the issue of anaphylaxis, because that is a life-threatening condition. And the the initial reports of the possibility of anaphylaxis have actually shown to be over estimates of what they are now. So that now Moderna is something like 2.5 cases per million. These are not fatal either. I mean, I think that, that's the other thing. They can be. They're terrible. Nobody wants it. But 2.5 per million is not a high number. 5 per million for the Pfizer. That's not a high number. We have vaccines that we give to children that have much higher numbers than that. And we give them to children because it's safe. It's safer for us to put our own children who don't have any illness when we give it to them, the risk of something like this, because the risk of not doing it is so much greater.
Yeah, I'll let anyone else jump in, but let me just add to this a related question that people with medical issues, diabetes, high blood pressure, et cetera, are at greater risk given the vaccine. Obviously, they're at greater risk of dying of COVID too, but throw that into your consideration, and please, anyone else who wants to speak to this.
I don't know if I would agree that they're at greater risk with the vaccine. I think that they're absolutely at greater risk of complications from the disease that we're trying to prevent here of COVID-19. You know, we've vaccinated over 16,000 people here in Humboldt County, and I'm sure we've had a handful of reactions, some of them mild, many of them mild, some of them moderate. We haven't had any severe reactions that I know of here in Humboldt County. We've got about 25% of our 75-year-olds vaccinated right now, and everyone's doing good. I think those numbers are exactly what you said, Congressman Huffman. They're expected for this age group. That, you know, but it's not a causal relationship. You can't pin the blame on the vaccine.
In other words, if you have thousands and thousands of people over 75, within a certain number of days, a certain number of them are going to just die actuarially. And there has not been, the difference between correlation and causation is pretty important there. Last one on this subject, and then I'll go to Jenny. And this is maybe the easiest one. It says, even Merck has dumped vaccines and stated it's far safer to just get sick and naturally recover. I just did a quick fact check of that. That is not what Merck said. This is something that got published on a website somewhere. Obviously just caught fire on social media and made the rounds, and Merck has said, that's not what we said, that's not what we believe. They stopped their vaccine program for totally different reasons, not because they think the vaccines are a bad idea. But any of you that want to speak to you know, some of this, the stuff we hear in opposition to vaccines, please jump in.
Yeah, I just want to say that I think the most important thing with vaccine hesitancy is that we hear it out and that we hear the concerns and we try and address them, not necessarily squash them. We have a really robust program through our integrative health department at the VA that has weekly sessions that veterans can attend if there's any kind of vaccine hesitancy. We had 85% elective vaccination for our employees, which is incredibly high across the country. But I think continuing the conversation is the most important thing, because there are more of those questions out there and there are more incorrect websites with information that is misleading. So I'm grateful for those people who wrote those questions so that we can address all of them and bring it on. We want to hear more.
Amen. All right, Jenny, fire away from our Facebook Live questions.
All right, this question came up last week as well. And Karen is asking, if you've had COVID, should you get a vaccine? If you actively have COVID, should you wait a period before getting a vaccine? Or if you've recovered from it, should you wait a period before getting a vaccine? And do you need both shots? So what's the protocol around people who have active COVID or who have just recovered from COVID?
I can address that. I think, so if you've had COVID, yes, it is recommended that you still get your vaccination. The timing of that vaccination, based on the CDC guidance, is at least 20 days after your first test or 20 days after the resolution of your symptoms. And so there's at least about a 3-week period. And yes, you should get both doses if you're getting the Moderna or the Pfizer. There is nothing to make us think that you do not need a vaccination having had native infection.
Yeah. The one
I'll just
complication
add
I
one
heard
thing.
from a colleague of mine who had COVID and got the monoclonal antibodies. Not many people get those, but if you happen to have gotten those, your system is so chock full of antibodies that they want you to wait a longer period of time before getting the vaccine. So that was the only thing I wanted to add in. Sorry, Dr. Huffman.
Oh yeah, no, that's a great point, Congressman Huffman. And we, definitely want to get that out there. Also, if you're on quarantine or isolation and you have an appointment for your vaccine, please reschedule it. Don't come in during those periods. That's an important issue as well.
I would add another thing to this conversation, the mix, is if you haven't had a vaccination yet, if you're not between vaccinations, and you do get the illness, then it's reasonable to put off the vaccination for several weeks, even up to 90 days, because the likelihood of getting infected during that time is extremely small. And so during this time, your vaccines that you'd like to get can be used for another person, and it'll still be around when you've recovered.
All right, I'm going to combine two questions for our last question. I promised folks that this would be a 1-hour town hall, and I don't want to take too many liberties with my panelists here. But one of my constituents writes about having a small business and wondering, since he can't get all of his workers vaccinated in Humboldt, whether he should send them to other neighboring counties to get them taken care of. And then a similar question for the VA. A constituent writes that they have an upcoming medical appointment at the San Francisco VA and is wondering if they can receive a first shot down there and then a second one at the Eureka Clinic. So what about folks who want to kind of mix and match where they get their shots?
I'll take a shot at that part. I would just say, it's really going to be better for everyone if you can get a shot in your home county. And maybe our public health officers won't agree with that, but I think for the state, for the sake of tracking everything, so everything is complete. I just think you run the risk also of going to another county and having them ask you where you live and having them tell you, no, you need to go do it in your own county. So I think you're much better off doing it at home.
You also don't want to mix the vaccines. If it's a Moderna or a Pfizer or whatever, it's very important that you make sure you're getting the same vaccine the second time.
I think the exception to the same county is when for example, healthcare workers are getting their vaccines where they work. And that's a good program because they'd have to hunt around if they're not in that county to some other place. And we really want to get the healthcare workers vaccinated in the most efficient way possible. And that would be where they work if their work is distributing vaccine, which they pretty much
are. Yeah, we've definitely dealt with that here in Humboldt County with a fairly large healthcare system for a county of our size and many folks who travel. And so they might have got their first dose in another county and they're here working their shifts for 2 weeks in Humboldt, and then they get their second dose here. And that's expected. But I think for the vast majority of people, like pretty much everyone else, we're not traveling that much. We're staying close to home. So you're going to get your second dose here in the county, and you'll get contacted when the time is to get the second dose.
Dr. Nye?
Yeah, at the VA, we also encourage people to stay within their home CBOC. We recognize sometimes there are exceptions to that. If somebody is an inpatient and gets vaccinated and goes home, it would be prohibitive to come all the way back. But we also schedule our second dose at the time of the first dose. And so because we have a mirrored grid, because we hold on to those second doses. So I would say that the exception would be that you could get it in 2 different places, and we much would rather have you get both of your doses in your home CBOC or both of your doses at San Francisco.
And I assume, Dr. Nye, that the VA is using all the same vaccine, that they're not mixing Moderna and Pfizer, or what's the story there?
question. It depends on which site you're at. The San Francisco VA is using all Moderna at this juncture. Our VISN itself, which includes Palo Alto and Fresno, some sites, I think Las Vegas and Palo Alto, are using Pfizer and Moderna, but our site and our CBOC are using just Moderna.
Okay. Anyone else? Assemblyman Wood, any closing thoughts before we let folks go?
Just thank you once again for putting this together, and just as we heard from the doctors, please be patient. You will get vaccines, but also the social distancing, the masking, hand washing, all that's going to be really important until we get to the point where we have that herd immunity, and that's a number we haven't talked about tonight, but that is essentially 70% to 85%, depending on of the numbers, and those numbers come from Dr. Fauci, and that's when I think we can all hopefully have a big demasking ceremony or something at that point. I don't know what we'll call that, unmasking. But it's important that it is, just because you've gotten the vaccine doesn't mean that this is over, and you need to protect yourselves and protect others, more importantly.
Yeah. Well, thank you for your leadership, Jim Wood. Thank you to my excellent experts who have joined me, who are doing great work in different parts of the communities that I serve. And thanks to everyone who logged in with us. I hope we were able to provide some useful information and answer your questions tonight. We will keep doing it. And so I'll see you next time. In the meantime, stay safe. If you want to see the version of this town hall or share it with anyone, you can go to my website at huffman.house.gov. And if you're with us on Facebook Live, you're already right there. So you can share the link that you're watching right now. Thanks, folks. Take care.
Thank you.